So hi guys, you're welcome to the Dssg Nation. So if this is your first time watching a video from the Dssg Nation, do make sure you subscribe and hit the bell button so we can notify you whenever we create any video. So today I'm going to be teaching you nursing management, and trust me, it is not going to be stressful. Under 7 to 8 minutes we are done. So I'm going to give you the tips to write a comprehensive nursing management. So whenever they ask which student, write nursing management for a diabetic patient or for an hypertensive patient. So it has become really confusing that we have hard time deciphering what exactly they want us to write. But trust me, I'm going to take you on that very simple journey right now. I am going to get it. And as from today, you will be able to apply nursing management to any disease condition. Trust me. So make sure you stay tuned. So, nursing management. Now, what is the meaning of nursing management? So, nursing management are just the management that you will give to a patient as a nurse. We are going to be looking at a definition. Nursing management that are going to give to a patient as a nurse. Okay, tell me. What's going to be a definition? So surgical management, that's as a surgeon. So forget about that. Forget about the definition. There is something that you have to know under this nursing management for you to be able to apply it to what? Any disease condition. And that is what? Acronym and format. Acronym and what? Acronym and format. Forget about the definition. They won't ask you define nursing management. So if they ask you define nursing management, still you are going to use something to write. Forget about that. Now, acronym and format. If you fail to know the acronym and format, forget about it. You're just going to be stressing yourself throughout the nursing management, and go to be having that time deciphering what you want you to write. Now, very simple. Let's go straight to the point. This acronym for nursing management, I know you have a lot sounding within your mind like that, but trust me, I'm going to give you a different one. But it is not that different, just a slight difference. What you want to tell me is a reader. If I want to disprove it for you, I'll be asking you some kind of questions. But since we are time bound, I don't want us to waste our time. Let me just give you mine. So my own acronym is what? A, rope, D, dia. And that is it. Now, this A means what? Admission. Admission. And the R is the assurance. The assurance. And this O is observation. Observation. And this P is physical care. And the D is diet. So diet should come before food. Diet should come before drug, brother. You have to eat before you take your drug, although not every drug. So we'll be talking about that some other time. So I is investigation. And the A is advice on discharge. Advice on discharge. Now, these are what? These are acronyms. Now, what are the formats? It is very simple. So I'm just going to pen this and then we'll talk about the formats too. So now, I'll be giving you the acronym here and then the format here. So, acronym, then format. So not to waste too much of the board, let me put this here. Now, we said we have our here, and the A is what? Admission. So, how do you write your admission? The format for admission. What I mean by the format is the exact way you are going to put it down in your exam. That is the format. So, the format for admission is what? Admit patient on a dash bed. So that's how I'm going to write it in the exam. So this dash is a type of bed. Type what? Type of bed that is suitable for your patient. So let's say the person has malaria. So for the admission, it should be admit patient on a simple hospital bed. But let's say something like musculoskeletal disorder, such as fracture. So this admission will now change to what? Admit patient on a fracture bed, or you say orthopedic bed. So if the person has a kind of cardiac disorder or difficulty breathing, you can say admit patient on a cardiac bed. So, and that is just simple format for that. And now the next one is what? R. The R is reassurance. See, this reassurance, it is constant throughout all the disease conditions. So even if you don't have this condition, that should not be a reason for you not to put it down. So you must get that mark. So it is what? Reassure the patient. Reassure the patient to allay anxiety and fear. To allay anxiety and fear. So that is what? Reassurance. It is constant throughout all the disease conditions. So the next one is O. And O is what? Observation. So the meaning of observation is nothing. It basically means vital signs. Vital what? Vital signs. So what I'm going to say is perform vital sign, especially, or you say and monitor. It depends. So I monitor what? The affected vital sign in that disease condition. Our vital signs, we have the what? TPR, BP, the temperature, the pulse, TP, then R respiration, and the BP is blood pressure. So let's say you are asked to write nursing management for an hypertensive patient. It will be perform vital sign, especially blood pressure. Do you get that? So let's say the person is suffering from like infection, and you know fever is a sign and symptom of infection. So you can just say perform vital sign, especially what? Temperature, or you should monitor the temperature. So that's how to do the what? That's how to write the what? The observation. And then the next one, arrow P. P is physical care. Physical care. Now, this one varies too, but it has its own constant thing that you are going to do. So in the hospital, the physical care we used to do is what? Just say perform bed bath, or you say assisted bed bath. So make the bed. So they are physical care. So make the bed. So and then what are other physical cares? Oral toileting, so etc. So all these, just put it there first, you get a mark. So treatment of prayer areas. So treatment of prayer area. It's also a constant mark. It is what we do. Treatment of what? Prayer area. So there are constant procedures that we do. Prayer areas. So this physical care is talking about nursing procedures. So these dash that I now put here are the procedures that are peculiar to some certain disease condition. Let's say the person is suffering from kidney disorder. So you are going to put on there, weighing the patient daily. So you monitor the input and output. So all those kind of things are the dash. So it depends on what the disease condition you are talking about. Now the next one is what? Arrow D. D is diet. So diet too is not constant. It depends on the causes of that disease condition. So, but majorly we need to have what? Maintain a balanced diet. So let's say the person is suffering from hypertension. You know, hypertension can be caused by increased sodium intake, salt, or increased fat intake. So, or it can also be caused by what? By stress and the likes. So you can just say reduce salt intake for hypertensive patients, and then reduce what? Fat intake. So, and something of such. If it is infection, you can say increase protein intake. So as that will help fight what? The infection. So you get a better understanding of this. If you stay tuned on this channel, as we are going through those conditions, we'll be telling you the reason why you have to restrict or why you have to increase. So that is that on diet. So then the next one is the drug. So the format for the drug is administer prescribed dash, and that dash is group of drug. So let's say the patient is suffering from malaria, and you are asked to write the nursing management for a malaria patient. So it is what? Administer prescribed anti-malaria. So If it is hypertension, administer prescribed antihypertensive. So you can put, you can put classes under it. Like if it is antihypertensive, you can be talking about beta blockers, alpha blockers, and the like. So, and that is about what? About the drug. So, arrhythmia. So we have I, and the I is what? Investigation. So this investigation is talking about the lab values. The lab what? The lab values, the tests that you run on the patient. So there are some certain tests that are just like constant tests. So if you put down test to get the mark, so you can just say conduct or perform retroviral test. So full blood count. So female they used to perform PT. So and the likes like that. But we are going to leave space for at least 2 tests. So what are the space for those 2 tests? They are the tests that are associated with that disease condition. So let's say someone is suffering from peptic ulcer now. So you are writing a nursing management for a peptic ulcer patient. So it will be conduct all these things. Then this dash should now be what? Endoscopy. So and then barium meal. So you can just add some other tests that you can use to diagnose peptic ulcer to it. If it is fracture, you can put CT scan and some other things that you can use to diagnose fracture. So that's the function of the 2 dashes that is remaining there. So the last one is A. So A is advice on discharge. A is what? Advice on discharge. So what are you going to say? So you advise the patient on discharge on majorly 4 things. So you advise the patient on the causes of the disease condition. So you educate the patient on the causes so that recurrence will not occur. So the causes, that's the first one. So you advise the patient on the prevention. Second one. So the next thing, you advise the patient on adherence. So like the patient should adhere to the treatment regimen. So treatment regimen can vary from exercise to diet. So and some other things like that. So then, and the last one is what? Keeping to the date of appointment. Date of what? Appointment. Keeping to the date of appointment. So those are the 4 things that are going to advise the patient on when it comes to advice to discharge. So this is what nursing management in a bit. So these are the acronym and their meaning, and these are the formats that I used to write it. So I want to believe you will get a glimpse or a better understanding. I don't want to go in for the game. So and now the next class will be for nursing care plan. So we are going to trash nursing care plan in 2 videos, just 2 videos. So make sure you don't miss it. And not to miss that, you have to do what? You have to subscribe and hit that notification icon so that whenever you produce the video nursing care plan, you can always be updated. They are going to be informed right away. So hi guys, you are welcome once again.